done. So this is my last one. She dated, whatever. Anywho.
The over there.
My cards. There's snow writing. They're ugly. The coffee stain. I think it's coffee. I really don't know what it is.
Ew.
I'm gonna tell you. What can I say except you're welcome?
Oh god,
We're gonna open it that way. Anyhow. You saw it. I gave it to you. Yada yada yada. I have, like, can I just, I don't know. Do you want to just choose one? You know, pick one, surprise me. You want to just go in order?
Sure.
Might as well. So, you know, let's start from the back.
Oh, that changed your mind.
Okay. So, causes of stroke. I'm sorry. That, like, made me blank the way I said it. Causes of stroke. Oh, I am losing at this, making this the fast video. Okay. Anywho, so to major causes of stroke, it's going to be the absence of blood to the brain and a hemorrhage from a ruptured vessel in the cranial cavity. 5 common symptoms of stroke. Since you have all that blood in your skull, it's going to put pressure on you and it's going to cause a headache. Your headache's going to be like, oh my gosh, I feel so dizzy because of all the pressure, dizziness. You're going to start being confused, and then you're going to feel sick in your stomach. You're going to get nauseous and you're going to throw up. That's your 5. S in stroke means smile. If it's drooping, it's an indication of stroke. T means talking. If you're slurring, indication of stroke. R, raise your arm. If it drops, indication of stroke. You get it? Thanks. So pupils, if one is not the same, that indicates stroke. Would you give aspirin? No, you wouldn't give them aspirin. And why? Well, because it can cause a cerebral hemorrhage. Remember that hemorrhage word I said earlier? This time it's inside your brain. What position should you place a patient in who is having a stroke, and why? Well, you'd want them supine to relieve the pressure in the brain. The 4 things you're going to get your classmate get: clipboard, emergency kit, AED, oxygen. How often are you going to take vitals? At least every 5 minutes. Can we give oxygen to a patient who's having a stroke? Yes, you can. And then you're going to give them 5 to 6 liters per minute. You're going to do that every single time. Where should you document everything that occurs during an emergency? The medical emergency report form and your patient's record of treatment. If your patient has an emergency, where should you remain until the emergency situation is completed and resolved? You want to remain with the patient until till it is completely resolved or EMS arrive. What is the number 1 thing you can do? You're going to take a good medical history. In your own words, step by step, tell me how you treat a stroke emergency in our clinic. So what you're going to do is, once you identify it's a stroke, you're going to call code blue. You're going to call code blue. You're going to ask a classmate to get those 4 items. Once they get those 4 items, you're going to ask them to call 911. You're going to have your patient, and you're going to make sure that they are supine, just in case. If they have no pulse and if they are unconscious, you're going to be able to start performing CPR. From there, you just keep doing CPR until they are conscious again and have a pulse, or until EMS arrives. I said we're going backwards. What's next? Cardiac arrest. What does it mean if a patient goes into cardiac arrest? The blood flow is inadequate to maintain life. Can angina and myocardial lead to cardiac? Yes. What must be done in order to save a life to a patient who has gone into cardiac? Do CPR. What does CABD stand for when it relates to CPR? C, check the heartbeat. A, airway is open. B, breathing. D, determine treatment. What position should you place your patient into in order to perform CPR properly? Supine. If you give patient 2 breaths and the chest does not rise, what does that indicate? The airway's not open. What is the ratio of compressions to breaths? 30 compressions to breaths. When should you stop administering CPR? When the person is resuscitated or EMS arrives. 4 things: emergency clipboard, emergency kit, AED, oxygen. Explain the technique for CPR beginning when you first realize that your patient has gone into cardiac arrest. What you're gonna do, I gotta stand up for this. It's stressing me out. So you're going to lay them down. You're gonna call code blue. You're gonna ask the classmate to get the 4 items. You're gonna call 911. You are going to ask the patient if they are all right. If they don't respond, start doing CPR. You're gonna check their carotid pulse, and if there is a pulse, you are going to just give 1 breath every 5 seconds. If there is no pulse, you're gonna start CPR. And in between each cycle, you're gonna keep checking that carotid pulse to see if you can switch over to the 1 breath every 5 seconds. And you're gonna keep doing that until your patient comes back or EMS arrives. And how often should you take vitals? At least every 5 minutes. Where should you document everything? Record of treatments, medical emergency report form. Where do you remain with the patient or until your EMS arrives? Number 1 thing you can do, good medical history. This is stressing me out, like flipping all around. Okay, so angina, what are the 3 layers of the pericardium, the myocardium, the epicardium, the endocardium? What blood vessels supply and oxygen? What's blood vessels supply blood and oxygen to the muscles of the myocardium? The left and right coronary arteries. What is atherosclerosis? Wow, that's the fastest I've ever said that word. Anyway, so that's when the walls of the arteries are coated and restricts blood flow. How does our atherosclerosis, how does it cause angina pectoris attack? So it decreases the blood flow to the myocardium, and that leads to deficiency in oxygen. When a patient experiences pain from angina, it's felt substernal chest pains, the neck, the jaw, and the arm. How long does it last? 3 to 5 minutes. What happens to vitals? It slightly elevates in an angina pectoris attack. 4 items: emergency clipboard, emergency kit, AED, oxygen. What position should you place them in? Upright. Most are relieved by what? 2 things. It's going to be oxygen and nitroglycerin. How often should you take vitals? That one is at least every 5 minutes. What is the drug of choice to relieve? It's going to be nitroglycerin. How does the nitroglycerin work to relieve it? It is a vasodilator, so it dilates your blood vessels. How much oxygen should we give to a patient who is having an angina attack? 5 to 6 liters per minute. Where should you document everything? Record of treatment, medical release form, medical emergency report form, not relief form. If your patient has an emergency, where should you remain with the patient until it's resolved or EMS arrives? Number 1 thing you can do to prevent, good medical history. We got 2.5 minutes. What is atherosclerosis, and how can this disease increase a patient's chances of a myocardial infarction? So it's basically what I said before. It's gonna the walls of the arteries are coated. When they're coated, it restricts blood flow. When it restricts blood flow to the arteries, your arteries constrict, and that leads to like oxygen deficiency. Pain from angina is caused by stress and exercise. When does it occur for myocardial? I'm trying to speak so fast, I don't even know what I'm reading. It's caused from stress or rest. And which emergency is more severe and longer? It's myocardial infarction. Is the pain from myocardial infarction relieved by rest and nitroglycerin? No. How much aspirin should be given to a patient? It's going to be 4 to 81 milliliters of baby aspirin. In what situation is not advisable to give a patient nitroglycerin? If their systolic blood pressure is below 100. What typically happens to BP of a patient who is having a myocardial infarction? It goes down. Should you call 911? Yes, because of the chest pains. What are the 4 things? Emergency clipboard, emergency kit, oxygen, AED. What position should you have them in and why? You want them in the sitting position. It'll make it easier for them to breathe. What usually happens to respirations when a patient is having a myocardial infarction? Shortness of breath. How often should you take vitals? At least every 5 minutes. How much oxygen should be given to a patient? 5 to 6 liters per minute. What should you do if your patient who's having a myocardial goes into cardiac arrest? Call 911 and start CPR. Where do you document everything? Record of treatment, medical release form. Where should you remain with the patient until it's resolved or EMS arrives? What is the number one thing you could do to prevent an emergency? Take a good medical history.